All right, good afternoon, everyone, and thank you so much for joining us for today's Learning in Action Network webinar, Patient Referrals to Self-Management Programs. My name is Rebecca Bowdy, and I am a Facilitation and Improvement Specialist with Oregon Healthcare Quality Corporation, which has been contracted by Health Insight Oregon to coordinate and facilitate these LAN webinars. And so my role today will simply be to introduce and moderate. And first, a brief introduction to Health Insight. Health Insight is the Quality Innovation Network Quality Improvement Organization, or QIO, serving Nevada, New Mexico, Utah, and Oregon. There are 14 QIOs that bring Medicare beneficiaries, providers, and communities together in data-driven initiatives that increase patient safety, make communities healthier, better coordinate post-hospital care, and improve clinical quality. QIO work is grounded in principles aligning with the goals of the Centers for Medicare and Medicaid Services, CMS, quality strategy to eliminate disparities, strengthen infrastructure and data systems, enable innovation, and foster learning organizations. Along with the other regional QIOs, Health Insight is leading healthcare quality improvement initiatives, including the Million Hearts Initiative for the Medicare program, for a 5-year period from 2014 to 2019, guided by CMS. And this webinar, as I said earlier, is part of the Learning in Action Network efforts under that CMS project on cardiac health. Here is just a infographic, quick reminder about our targets for Million Hearts. This can be found on the Million Hearts website, linked there. And a quick introduction to some of the technology that we're using today. Throughout the presentation, we'll be checking in with you, and we welcome you to submit your questions via the chat pane, which is displayed here on the slide. Everyone will remain on a global mute throughout the presentation to reduce feedback noise, and we have set aside we've set aside time at the end of the webinar for your questions. And you can type them here, and I will sort them for our presenters to answer. Also, if you have any technical issues throughout the webinar, please feel free to submit them through that same question pane. We also ask you to please complete a post-webinar survey to help us on our improvement journey. Here are our learning objectives for today's webinar. I won't read through all of them. You saw them when you registered, but it's sort of a lot that we're going to cover, but we really want to help you to set up your referral workflows and learn the benefits of self-management programs. And to do that, we have two wonderful presenters here with us today. First, we have Janet Tennyson, who is has worked as a practice facilitator for 5.5 years at Health Insight. She has assisted primary care practices with implementing formal referral management processes for quality improvement projects, particularly in the area of patient-centered medical home recognition and in the National Beacon Project, where she assisted practices in referring patients with diabetes to community organizations for assistance. Also with us today is Deanne Curtis, who is a self-management workshop graduate. Deanne is a lifelong resident of Salt Lake City. She has been married to David M. Curtis for 37 years. She has 3 daughters and 7 grandchildren. She graduated from Skyline High School and got her bachelor's degree in educational psychology from BYU and her master's degree in communicative disorders also from BYU. Deanne worked for Granite School District as a speech and language pathologist in special education preschool. Her hobbies include knitting, reading, quilting, and tending grandchildren. She enjoys her daily walks in her neighborhood and likes to spend her time doing community service in her church and has served on the auction committee for the University of Utah Hospital Foundation. She resides with her husband and her toy Australian Shepherd, Enzo. Thank you so much for joining us, Janet and Deanne, and with that, I will give it to you.
All right, well, thank you so much for having us, everyone. We are so excited to be here, and we were on mute while you were introducing us, and we were kind of giggling here about Deanne's introduction there with your dog. Very cute. And I just want to shout out to Deanne for joining me here today. She's a busy gal, but she's made time to come and share her experience with us all. So thank you so much. So what I'm going to do is talk about self-management first and kind of talk about the definition of it and the benefits. And then we'll hear from Diane, who's attended a self-management workshop. And then we will move along and talk about how to set up referral processes to get folks to attend these awesome workshops. And you know, initially this is work that I've done in the primary care clinic, but I wanted to point out that it is work that can be done anywhere. There's just some kind of key components to it that will work in any organization. So anyway, let's go ahead and move along. And again, thank you so much for allowing us to talk to you today. So what is self-management? It's really funny because I go out into provider offices almost every day, and I talk to them about self-management, and it still seems like there's a lot of misconception about that, what that is. And so I'm an academic person, so I like to get definitions out there so we're all using the same language and the same, you know, have the shared understanding of what we're talking about. And so you can see here, this is from the Institute of Medicine, and I underlined the word skills and competence. So it's systematic education and supportive interventions to increase patients' skills and competence to manage their own problems. And I'm fond of saying that we can give patients a ton of education about diabetes and congestive heart failure and things like that, but if they don't have the skills and competence to actually use that education, then it might not, I don't want to say that all the education in the world is useless because that's not true, but it might not be as effective as we would hope it would be. Okay. So here are some differences between traditional patient education and self-management education. And if any of you out there know Dr. Tom Bodenheimer, he is at the University of California, San Francisco. He is, to me, the father, the guru of self-management. I've actually had a chance to meet him, and he has been writing about self-management prolifically for probably about 20 to 30 years, and so he's been on this for a long time, and I really trust him and admire his work. So here's what he says, that traditional patient education is you know, about technical skills, and I'm going to use diabetes kind of as our example today. So that would be something along the lines of learning how to use a glucometer. Problems with disease control, disease-specific knowledge. Goal is to improve compliance and improve outcomes. And in traditional patient education, it's sometimes maybe a little bit more of a one-sided relationship where the health professional is the educator and knows everything. And so compare and contrast that to what self-management education is. Very different. We want to give patients skills to act on problems. So yeah, and patient education is completely, absolutely necessary because we do need to know how to use a glucometer. But what do we do when our blood sugars are too high? You know, we want to be able to have patients identify problems that they're experiencing because we don't know what's happening in the home. We might not be seeing this patient, you know, all the other times, you know, 364 days of the year. We want to improve confidence and self-efficacy, you know, that people can take care of themselves when they're not with us. And so self-management education is a little bit more of a peer type process. And so again, Dr. Bodenheimer would say that traditional patient education, maybe the professionals are the experts and patients maybe just sit and listen, where in more of a collaborative approach, meaning we bring the patients in, we bring the families in, everybody on that care team, we can talk, we are the experts about the disease, but patients know their lives a lot better than we do. They're living them every day. Behavior change is externally motivated versus behavior change is internally motivated. And if anybody out there knows about motivational interviewing, you know that studies show in motivational interviewing that behavior change is much more likely to occur if we change for our own reasons, not for the doctor's reasons. And noncompliance is a personal deficit. And, you know, we go out into clinics every day, and I do still hear providers talking about their non-compliant patients and how they can't get them to do what they want them to do. And we do have truly non-compliant patients. But wouldn't it be nicer if we could think about it maybe as, instead of being non-compliant or non-adherent, that maybe the goal achievement, maybe the goals aren't really hitting the mark. And maybe we need to help our patients modify those and make them more relevant to their lives. So I want to talk about specifically the Stanford University. They call them a suite of self-management programs. These were developed obviously at Stanford University, and they have, as you can see here, they have self-management programs for chronic diseases, for specifically for diabetes. They now have them for chronic pain, cancer survivors, and HIV. And in the 4 states that are in this QUIN, we are all promoting Stanford's diabetes self-management programs, as well as the DEEP program, which is Diabetes Empowerment Education. And then all of us have really nice partnerships with, and you might be on the phone and you're awesome, with our departments of health, and doing and helping to promote national diabetes prevention, falls prevention programs, and things like that. And I just want to say how wonderful these programs are. And I was just telling Deanne before we came on that I don't feel like our providers here in Utah know about these as much as they should or could, and they're so beneficial, and most of them are free. And so I'm like, oh, it's so, and that's why I'm here talking to you, because we really want to get the word out about these programs because they are awesome. Okay, so the Stanford Diabetes Self-Management Program, it's evidence-based, and Dr. Lorig, Kate Lorig, she's a researcher there who studied this program in and out for years. And so it's highly evidence-based, lots of studies that show that it works. Of course, it's self-management focused. It's 6 weeks of workshops, so it's every week, and folks attend the workshop for 2.5 hours. And the folks that lead the workshops are not medical professionals. They are peer leaders who have diabetes. And I actually am a peer leader myself. I don't have diabetes, but I have family members that do, and so I feel like I have a pretty good knowledge of what that's like. And additionally, I was trained by a person who happens to be Deanne's daughter. And I saw Deanne's daughter, her name's Emily, last week, and she has lost 160 pounds. Wow. I said, where's the other half of you? Where did it go? So anyway, kind of a neat thing to see. So that's for the program, no cost, and family members and caregivers are definitely invited to attend. You know, we don't live in a vacuum. What we eat and what we cook affects everybody in the family. And we have many workshops that are located throughout the state in many different areas and in different types of facilities. So you can see here, you know, a lot of folks ask me, well, what's the difference between this and, you know, diabetic education that's provided by a diabetic educator or things like that. This is, again, a 6-week program, and you can see here every single week that there's something different that we help folks with. And I'm going to have Deanne kind of talk a little bit about how this has affected her life. But you can see some of the kind of atypical issues that we don't, you don't know that are being talked about in some of the other types of educational programs. like depression and positive thinking. We actually do relaxation techniques. We help people learn how to relax themselves and things like that. So it's a really neat program, and I have to tell you, I love when I get to lead people through this. It's probably one of my favorite things to do. So again, this has been studied a lot. Dr. Lorig is the key researcher at Stanford University. And look at this. Wow, this is just one study, but we can see not just afterwards, but 6 to 12 months after a workshop completion, 345 folks that had type 2 diabetes had pretty significant improvements in a lot of their symptoms, depression, and they're eating better, they're exercising, they are better able to self-manage themselves and have better outcomes. And so I am going to have Deanne actually, as a self-management workshop graduate, congratulations, talk about what this program has done for her and means to her. So without further ado, go ahead and tell us what you want us to know, Deanne. Thank you so much.
Okay. I was diagnosed with diabetes in April of 2015. I knew some things about diabetes. My mother, who I cared for in my home the last 3 years of her life, had diabetes, and my brother, who lived in Colorado, also had diabetes and actually died from some of the effects of diabetes. So when I went to the doctor and he told me that I had diabetes, at first he thought it was thyroid issues, and so he did some blood tests, and I went back 2 days later and he said, no, you have diabetes. And he gave me a book and opened the book and circled what my A1C should be and turned a few pages and circled what my blood sugar should be. He gave me some prescriptions for some medications. He gave me a prescription for a glucometer, and he also gave me a prescription to go meet with a dietitian in about a month. So I was quite taken aback by this. I knew some of the bad things about diabetes, for example, neuropathy, heart disease, kidney disease, and how it can affect your eyesight. But I didn't know how diabetes would affect me or what I could do to manage my diabetes. I heard about the class that we're talking about from my daughter, and she actually was the one who taught me how to use my glucometer. I didn't learn that from my doctor or from the pharmacy or anyone. And she helped me to enroll in a class, which I started immediately. And I learned a lot of really good skills. I learned about making action plans. An action plan, to me, is what you plan to do this week to help yourself not get some of the really bad side effects of diabetes. I've always heard, if you don't have a plan, you plan to fail. So I took that to heart. The class taught me about monitoring my blood sugar and about nutrition. I loved the 2 or 3 sessions that we spent actually making food plans so that we could see what things had high carbohydrates, which things had low carbohydrates, and managing our meals. We were taught to exercise at least 30 minutes a day. I have tried diligently to do that. I go on 1 or 2 walks a day, and always keep my people laugh because I have to run back and get my phone because it's keeping track of my steps. So I try really hard to keep track of my 10,000 steps at least a day. We talked about dealing with difficult emotions, And that was really important to me. When you have kids and grandkids, you have stress because you're always worried about them because something's always happening. And so for me to be able to learn some relaxation techniques without feeling guilty, you know, like it's okay to sit down and knit. You don't have to feel guilty that you're not doing something else. So I found that very, very helpful. I also thought it was really helpful that we learned what to do when we're sick. Last November, I had 3 surgeries, not big surgeries. Well, one of them was a rotator cuff, but just to be able to know what to do in that circumstance. Obviously, I wasn't feeling like eating healthy, but what I did know is that I had to test my blood glucose every 4 to 5 hours. I had to drink fluids every half hour, and I had to keep taking my medication. And I also learned to talk to my husband and explain to him, if there's a problem, this is where my jelly beans are, which I carry with me all the time now. At the beginning, I used to get episodes of hypoglycemia. Now I don't. I keep my jelly beans with me. Mm-hmm. I also learned some problem-solving skills, and I learned how to communicate with my doctor. When I went back to my doctor the next year, I said, I had a class, and they taught me that you're supposed to be checking my feet. And he went, oh, okay, here, lay down, I'll check your feet. And he taught me what that foot exam was like. And we talked about my skin. I have very dry skin. So while I'm not a perfect example of these things that I've learned, I've lost 20 pounds, but not the 30 that was my goal. I keep track of my food every day. I use an app on my phone called MyFitnessPal. Also very annoying when you go to dinner with me and I am putting in my phone what I've eaten, what I plan to eat, what the carbs are. I check my nutrition, carbs, protein, fat. I have monitored that now for 310 days in a row. It would have been more except for the surgeries last November. I kind of let that slack a little bit. I do go for my walks every day and keep track of that. I monitor my blood sugar every day. I'm not perfect at taking my medication right before dinner. Lots of times I forget, but I always try and take it at least before I go to bed. So I'm still working on losing weight. I would highly recommend that healthcare professionals do more than hand you the book and circle the numbers. If it hadn't been for my daughter, I would not have known about this class. I would have not known that I could play a part in managing my diabetes. I would have probably felt like it was the doctor's job, and when I had high blood sugar, call him and say, what can we do different? Instead, I know that I can look at my food diary and I can look at my exercise log, and I know what I need to change. So I wish that everyone could be taught to self-manage. I think people would have a much better outcome with their diabetes.
Wow. Wow. I hope you guys are out there going, wow. Because I'm dancing around the room like Snoopy here. Woohoo! Thank you so much, Dan. Wow, that was amazing. You know, and I'd heard Dan talk about this a little bit before, but again, you can tell I'm just wowed. But if that isn't a success story, I don't know what. And she did show me her app right here, so she's telling the truth, folks. So let's talk about care coordination and referral management in today's healthcare environment, because guess what? It's changed. It's changing every day. You know, we are moving so rapidly from a fee-for-service to a system where we pay for quality instead. So let's talk about that, and let's talk about the ramifications, and then talk about how we can help you get your patients to this wonderful workshop. Okay, so care coordination, if you've been in healthcare for a while, you like me, you've seen the emphasis on care coordination just increase and increase and increase. And it really is, you know, I really agree with what is written here, that it really does have the potential to really improve the safety and efficiency of our healthcare system and patient outcomes. Okay, so if you haven't heard about MACRA and MIPs yet, I'm not going to get into this too much. At the end of this webinar, we will have, you know, phone numbers for folks in each of your states that you can call that can come out and help you with these issues. But this was you know, this is what was recently passed. The new rule, the final rule for this was just published last week or the week before, 900-something pages. But this is what is going to be replacing our fee-for-service system that we have. And you can see here that we have these different quadrants of activities that a provider will need to participate in to get certain points. And you can see up here in the right-hand corner where it really has an emphasis on coordination of care and patient engagement. And if self-management workshops to me is a wonderful example of I just lost my train of thought because I was reading something that Rebecca said. So MACRA stands for the Medicare and Medicaid, oh gosh, Reenactment Act. I think I wrote that on the next one, or you took it off. Oops, sorry. And I can't tell you what that actually stands for. But it is legislation that was just passed. I'm so sorry, I can't remember the acronym.
Okay, sorry, Janet. It's Medicare Access and Chip Reauthorization Act.
Yes. Okay. Thank you. I just know it as MACRA. I appreciate that. So this is what is replacing our fee-for-service system in primary care, and so you can see here that there are some different quadrants, and look at that 60% of the circle there is about quality, and so we really need to start focusing on improvement activities. And you can see the other quadrants here, you know, are the reporting part through meaningful use in electronic health records and things like that. So this is what is going to be starting here in 2017. Actually, the reporting for this will be starting really soon. And so we're trying to help people understand what this is, although I forgot the acronym, because we want to be able to help people align what they're doing in primary care and in the hospitals and home health and things to make sure that you're getting credit for these quality improvement activities. Okay, so the proposed rule did include, or does include, self-management education. Wow, look at that. You can actually even get credit for, you know, setting this whole process up and sending patients out to some of our community-based programs. And for those folks listening on the phone, if you are a community-based program, you know, definitely get with your Health Insight people and let them know you exist, because we definitely want to help our providers know that you exist. And you know, we want to make sure that patients are getting referred out to every place that they possibly can. All right, so again, care coordination in the MACRA system, you know, that again, you can see that clinicians are going to be rewarded financially, or the opposite, penalized, if they're not participating in these activities at some point in time. So to me, wow, these self-management workshops are so amazing, and they're free. Boy, I just want to, you know, encourage everybody I can to send folks to those. You can kill two birds with one stone. So why do we have such a difficult time with referral management? Now, I've worked with a lot of providers, and I did work with some providers, and I am working with some providers on patient-centered medical home. And one of the big areas of that to get certified is you have to have a really nice referral management system. So our big systems have third-party referral agencies that help them out, but some of our smaller ones don't. And so the accountability is shared sometimes, which creates ambiguity. We don't have time to get out even know who we are referring to anymore. We don't know who some of our specialist providers are. And guess what? Yeah, Medicare pays us a little bit to, you know, do chronic care management, not a lot. Oh, boy, I'm not sure why that went through so fast. Let me back up. And, you know, our smaller systems, we just don't have the time and the personnel to really be able to coordinate care effectively. It takes a lot of work. And so what can we do then to address some of these issues? Let's talk about that next. So, you know, we want something to get done, as Deanne just said there. Wow, what is it when you, if you don't have a plan, if you don't plan, you plan to fail. I like that so much. So just committing to something we know really helps. And this is what I have my clinics do. You're going to commit to this, right? Okay. And then we want to identify some cheerleaders in the clinics or the agencies. Somebody has to, you know, talk about this and talk it up and talk about its benefits and how wonderful it is. We might need to analyze the workflow and tweak the workflow a little bit to set up a referral management system. Oftentimes we really do need to dedicate a person or a couple of people that can take turns and help sign patients up for self-management workshops. And then I'm going to talk again a little tiny bit about motivational interviewing. You know, I held some focus group studies with patients here at Health Insight Utah, and I said, what could your provider say to you that would make you want to attend a 6-week-long workshop? Because that's what a lot of people are afraid of. People won't go because it's, you know, it's a pretty big commitment. But if the provider tells the patient in a way that resonates with him or her, they're going to be much more likely to want to go, right? Yeah. Dan's showing me something she's written here. They will go if only to avoid diabetic complications. They might do that, but let's talk about some other issues. You know, a lot of folks, you know, we talk about the medical complications of diabetes, and I think it's easy for them to say, well, that'll never happen to me, right?
Really?
And so let's think of some other ways that some other things that we might be able to say to folks to get them to go. Okay, so you know, I worked with a small clinic here in Utah, and we needed to improve their referral management system because it was pretty chaotic and nobody knew who was doing what, and they never knew if their patients went to their appointments, and that's really dangerous. And I have to tell you, it took us a year, which is a long time. But we did PDSA cycles, and we measured, you know, we tried little tiny things to change this part of the workflow. Okay, that didn't work. We're going to try this part. We're going to adapt it and just keep trying. And they were committed to it, and they finally got to where it is phenomenal now. And it's so phenomenal that one of the commercial payers here actually took notice that their patients are being are getting to their appointments, and they are incentivizing this clinic now with some extra funding. So, do you want to focus on a specific population to begin with? We can't send all of our patients. Boy, that would overwhelm us all and take forever. But, you know, when I work with clinics, I say, is there a certain population here that you work with that you're more concerned than others? At Health Insight, of course, we have a CMS grant and are focusing on Medicare beneficiaries. And that's a good place to start if you'd like. But, you know, depending on where you are and who you are and where you are located, you might have certain patients that you really want to focus on. And then we need to decide, well, okay, how will we find them? You know, I had one clinic run their EHR report, and they found they had 500 patients with diabetes. And holy moly, so we had to figure out how we were, we had to come up with a good strategy on who are the highest risk, how are we going to actually ask and talk to these folks. So, pre-visit planning is a really nice way to be able to do that. So a lot of providers have morning huddles where they say, here's who's coming in today. Oh, look, this person has diabetes, this person has diabetes, this person has diabetes. I'm going to make sure I walk these patients down to the registrar, the person who registers, and she's going to sign them up for the workshop before they leave the building, which we know is a best practice. Once we leave the building, it's sometimes harder to get a hold of people. So this is what I try to get my clinics to do if they can. Now everybody has different needs and different workflows and resources, so you might not be able to do all of this. I would encourage you, if you're listening and you want to, start small, and that's what we do with PDSA cycles. Start small, see if they work, and if they do and they're wonderful, roll them out to everybody. Okay, so, we know that having, that cheerleader again, studies show that this is really crucial to success and quality improvement, is having a clinic champion or an organizational champion who really believes in the program and gets it, and is just the person that's kind of managing it and talking about it and making sure it doesn't fall through the cracks. And then the provider champions are the ones that can go and talk to providers. Sometimes a medical assistant or an office manager goes and tries to convince the provider to do that, and it doesn't work. Where having physician to physician sometimes works a little bit better. Make it fun, have contests. You have a clinic that put up a whole bulletin board on self-management, and they have teams of, MA and provider, and the ones who refer the most patients in a month are going to get a gift certificate for a free lunch. And lastly, communicate what you're doing and successes to everybody. It's so great to hear somebody like Deanne talk. That makes it real. Everybody works in healthcare because we want to improve lives, and so when we can actually hear about how that's happening in real ways, it really makes a huge difference, doesn't it? Okay, so we really want to train providers and staff about the workshops and their benefits. We want to, talk to them about the necessity of having a commitment from them to send patients and to try to keep it on their radar. And again, what do we say to patients? How do we say it to get them to want to go? And then what I do, in Utah, we actually have this really great registration portal through our Department of Health. And I go into clinics and I say, let me show you this awesome URL, and I have them pull it up on their desktop, and I show them how easy it is to register a patient. It takes less than a minute, and then they just have to put the patient's name in, and it goes to the peer leader, who then calls the patient to remind them. And then I just have the clinic person save that registration portal on their desktop, and then whenever a patient needs to get signed up, they open it up, register them in it, and they're ready to roll. It's really easy. Okay, so the power of the recommendation. So we do have patients that, you tell them they are at risk for amputations and things like that, and they will, listen, and they will go to the workshop, or they'll do what you ask them to. Not everybody, Deanne, is like you. I hate to tell you. In fact, I'd say probably a lot of people are not like you. For whatever reason. I'm a mental health provider. We know people have denial, and they don't understand things, and they're busy, and so, they might not go to a workshop, but they might not, be committed to self-management. They might not understand what they need to do, and they might not really get it. Patients sometimes don't go to their appointments because we tell them it's in their best interest. And in fact, really? Yeah, studies. So you are,
I always do what I'm told.
Yeah, see? Wow, listen to that. I wonder how many patients. I used to work in primary care, so you are an anomaly. You are like the, what's that bird that's just extinct?
The dodo.
The dodo. She's a dodo. So, yeah, we tell them, but, for whatever reason, a lot of them don't go. So we need to help patients understand why, you might not want to go to a self-management workshop for diabetes because it's going to help you, live longer. But if I know you want to be able to be around longer for your grandkids, right? Well, would you be willing to go, Deanne? Because this might help you be around longer for your grandkids. You've told me you like to knit. You can knit like a demon, right? So we have to really kind of connect what your values are and what is relevant to you. And so we know patients are more likely to change behavior for your reasons, not ours. And a lot of times it's not for the medical benefits of it. It's for other things. So as clinicians, we're just much better off asking questions about why patients might want to change behavior and, tell me why you might want to go to a workshop rather than telling them that they should, right? People sometimes don't like to be told what to do. We can be kind of resistant. And some studies show that one of the major reasons why patients no-show, and there's a lot of reasons, so transportation issues and work, but there are studies that say, you know what, my provider, my primary care provider didn't listen to me today, and he wants me to go to this workshop. No, I don't think so, because I'm mad at him, so I'm going to resist and dig my heels in. They maybe are very dissatisfied with that visit. Maybe they feel like their provider doesn't listen, and they don't want to, we don't like to, tell our providers that we're dissatisfied with them. So we sometimes make up our minds before we walk out of the building, that, he wants me to go to that. Well, I'm not going because he didn't listen to me, and, I'm too busy. And so what can we do for that? Really quick. What would happen, this is my little tagline here, I kind of like it, check in before they check out. So what if we were to say as a provider, and I always did this as a mental health provider, I'd say, did I meet your needs today? Did we get to what you wanted to talk about? No, oh, I'm so sorry, I guess I missed the boat on you. I will make sure that we talk about this next time. But if we can take a minute out to say, did I meet your needs today? Tell me what you think about our visit today. I wonder if that would help, people to feel like they're heard, and, and I'm listening to them, and I'm telling them, about this great workshop, and here's how it could benefit you and help you meet your goals as an individual. All right. So a couple of other ideas. Some folks don't have the resources to have a dedicated person. I've also helped clinics. This is a lot more time and resource intensive, but they will send out letters and tell patients about the workshops and give them the phone number to try to call themselves, or they call patients and schedule them over the phone. I've actually done this for some clinics because I was really nice and talked to patients about the benefits of the workshop and got them signed up. But again, that's pretty labor intensive. Again, work with your health insight coach to help you decide what would work best for you, for your organization and your needs. Consider holding workshops in your clinic if that's possible, or in your organization. We've been doing that here in Utah, where we have some peer leaders that are willing to go into a clinic and actually hold the workshops there for that clinic's patients. And I got to tell you what, man, that has been magical. Patients show up and they complete the workshops because they know the staff, they feel comfortable there, and just a really great situation. Or even better, we're all always looking for those peer leaders. And so I've had about 5 of our clinics send medical assistants to go become trained peer leaders and they go back and do it all in their clinics, and it's just been phenomenal. All right, so look at that here, very smart. You'll have a formal care plan in your EHR, again, where you document your patient's care coordination activities, because we're going to need to start proving to our payers and our government and things like that that we are doing these activities. And the care plan has to be updated at every visit. And there's some revenue out there for providers that maybe they're not realizing right now with chronic care management coding and transitional care management coding that we can help you with as well. So if you're going to do it, document it and get the credit for it. I say, you're going to go through all that trouble. Why not get the benefit of it? Okay, so here are some. We can provide you with free assistance to help you with many of these areas. We can help you dig into your EHR. We can help you learn about this new payment system. It's actually called the Quality Payment Program now, and we really want to help providers, understand as well how to work with disparate populations, and we need to work with different, ethnic groups and different ages and populations maybe a little bit differently, and so we can definitely help you all learn how to do that to the best that you can. And so here are our names. Hope you know a lot of these people through your work with us, but definitely, my colleagues here that are all mentioned are just as passionate about this project as I am, and I know they would love to hear from you and love to help you get some folks there. And so I guess I'll leave that up for just a minute so people can furiously write that down, and then we'll get the line open for questions. And you can ask me questions or Deanne. We would love to hear from you. Okay. So here again were our objectives that we promised to help you with today. I do hope that we've met that need. Nothing worse than listening to a webinar or going to a conference and not feeling like you got what you were hoping for. So please do let us know what you think. And please ask us any questions or make any comments or reflections, because we would just love to hear from you. And I'm tired of talking.
Thank you so much, Janet and Deanne. And that was great. I think we heard a lot of really great suggestions for how to implement this. And Deanne, I really appreciated your story about telling your doctor that he needed to do foot exams and how powerful it was. When you said you wouldn't have known about these programs if your daughter didn't tell you, and that was really striking for me and kind of like a wow moment. And I hope that other people got those wow moments as well.
Yeah. So I see Carrie has a question here on the chat. Should I go ahead and respond to that?
Yes, there were actually a couple of other folks who had this question about, where are these classes available in my community, and how do I get connected? How do I start the process of setting up a referral with this organization?
Awesome. So I know we're talking to 4 different states, and so there are different mechanisms in each state to get folks to the workshops. In Utah, you can get on livingwellutah.gov, and that's that registration portal that I shared, and you click on it. It'll say, what are you looking for? You're looking for a self-management workshop, and you put the zip code in, and it'll tell you where the closest workshop is. I'll tell you right now in Utah, because we are getting ready to head into the holidays, we are not offering any DSMP programs because Stanford told us that's not a great idea until January. But you can look in that website and see other self-management programs, or you can talk to me or your Health Insight person, that, that phone number that and emails that I showed there. Let me back up if I can. And that person will be able to help you know how to connect to the workshops. That would probably be my best recommendation, because we do all do it a little bit differently in each state. So.
Perfect. Thank you so much, Janet. And I wanted to remind folks that these slides and the recording of the webinar will be made available on the Health Insight website probably in about a week or so. So you will be able to share them with your staff, and you'll be able to have those that contact information. We can also put it back up again really quickly so folks can write down emails and phone numbers.
And do we have other questions that I just don't see?
Other questions if you wanted to, but you can say what you were going to say, and then I'll ask the next.
Oh, okay. Well, and I would love to hear what some of the folks think about what Deanne said. Do you feel like maybe what some of the things resonated with you that she talked about or that I talked about, and what might you do differently, if anything, as a result of what you heard?
Perfect, thanks. Yeah, feel free to type that into the question pane and we'll read it out loud for you, or we can unmute you if you would like to verbally react to the story or ask a question. And while you are all thinking about that, I know there are a lot of touch points and moments in that story that we could reflect on. There was a question about tracking this for, somebody said prof, I'm not sure if that stands for something else, but we're starting an internal referral process. So how are you tracking? I'm guessing it's the, and whoever submitted this question, Diane, if you'd like to give some more clarification on this, but could you speak to that, Janet, how you're tracking this program?
Okay, sure. And oh, thank you. I actually, I put the slides together a little bit ago, and so one thing that I forgot to mention is that Health Insight, we're actually doing a pre and post. It's called a patient activation survey. So in the workshops, we have the peer leaders giving the participants, before they start the program, they give them, it's really a knowledge questionnaire. What do you know about this? How many times are you doing this? Who are you? How old are you? How long have you had diabetes? And then we give that to them after they've done the workshop to see if they're gaining knowledge. And in Utah, wow, I've seen some amazing trends that I find fascinating. And every state we are using these patient activation surveys, and CMS actually is, they're getting a ton of data about the efficacy of this program as well. And in Utah, what I'm seeing is that the majority of people that are going through the workshops are not newly diagnosed. Most of them have been diagnosed for 4 or more years. And I know, isn't that interesting? And they do gain a lot of knowledge from the workshops, and they are absolutely, same as Deanne just talked about, their behaviors have improved. So we are gathering that data. We're tracking how many people are going through the workshops. And I'm not sure who that person was, but we can help an organization or a clinic, if there's something that you need to specifically track for a payer or something like that, we'd love to help you set that up. And I've done that with clinics. I have a lot of clinics here who are getting financial incentives through some of their commercial payers, and I'll say, how can we align all of this together and make it a really nice package so you're not having to duplicate anything. We're also doing some pre and post clinical data gathering on, number of foot exams and things like that. So we have a couple of different measures. So I hope I answered that question okay.
I think so, and if we didn't, please feel free to submit another question in here. So there's a question for Deanne about her story, and knowing that you heard about this program through your daughter and her work, if your provider had been the one to recommend it, what would he or she have needed to say to you, do you think, to that would have made you feel comfortable or excited about going to this program?
I think if my doctor had told me, here's a booklet, and you can read this, and it'll teach you about diabetes. But if you go to this class, they will help you learn how to take care of your diabetes so that you don't have to come and see me more than once or twice a year, so that you know what to do to lower your blood glucose, so that you know what to do to keep your skin and feet healthy. I really think that if my doctor had said those things, I would have still signed up. And when I went to this class, it wasn't in my neighborhood. It was completely across the valley, and it was at 8 o'clock in the morning. And I had to be highly motivated to do that because I don't usually do a lot before 8 o'clock in the morning at this stage in my life. I hope that answers the question.
Yeah, I think that was really valuable. Thank you, Deanne. I'm writing that one down.
I think it's just so, it's always so great to hear about how this is actually working or not working, or how we can improve from patients and folks who are we're supposed to be helping through their wellness journey. And so thank you for sharing that, and I agree. 8 o'clock in the morning is kind of would be rough. And I was wondering too if you had any words of wisdom, or I mean, I think that was a helpful, what to say to patients for people not doing this yet. But any other words of wisdom that you would share with a clinic or providers or who aren't yet referring their patients, something that would encourage them to go that extra step and get started?
I think that providers have to recognize that this is a huge change in someone's life, that they all of a sudden have a problem that they didn't recognize or see coming. And so the provider needs to support them, but also explain to them that it doesn't have to be the end of the world. And if you go to this class, you'll learn how to make it not the end of the world. For me, I was telling Janet, my experience was that my brother actually had his toes amputated because of diabetes. And he fell one day and hit his head on the sidewalk, went into a coma, and I actually had to fly to Denver to turn off the machine. So to know that was in my background, and then learn that I had diabetes, and that I could take a class that could teach me how to not get where he got. That, I think that was highly motivating for me.
Wow. And that's, I'm sitting right next to Deanna, and I'm just like gaping at her, because those are just powerful words, and how, in our, our current healthcare system, we've been trained with the medical model, and, a lot of our providers don't feel like they have time, and they don't have time, to really dig in. And so how can we help folks be successful? How can we help get this message out? And Deanne, I just want to thank you so very much. I'm going to give you a big hug here in a minute, but I just wish folks could hear this and that we could help them. It's such a remarkable program, and it's free. And you know, so you all listening in, please, please, please help us get the word out. We would just so appreciate it.
Thank you.
Yeah, absolutely, and I just want to echo that too as well. Thank you so much, Dan, for being brave and sharing your story with us. I think it really makes such a huge difference to just hear your voice and the voices of others, you know, facing similar things like you. And you know, a couple people chatted in that they really appreciated hearing your story and really liked the point about making things relevant to patients, so not just telling them you need to go, but you know, making it relevant to their wants and needs and what's important with them or to them. And I want to thank Janet as well. Thank you so much for sharing your experience and wisdom and kind of helping us through with some of these tips and tricks to implement this. So I really hope that folks will be in touch with their contact, their Health Insight contact in their state with further questions. And if you have anything else, you have the contact information on these slides that will be posted. But other than that, thank you everyone so much for joining us and for taking the first step. And with that, have a great rest of your afternoon.
Thank you.
Thanks.
Thank you. Bye.
Bye.